my name is Dr. Vijita Patel. I'm co-medical director here at Highlands Rehab Hospital in El Paso, Texas, and we're going to do a short little discussion on heart failure. So first things first, what is heart failure exactly? Well, a simple way to kind of think about it is it's difficult for your heart to pump blood out to your body. Now there's two ways that this can happen. Maybe you've heard of the words systolic heart failure or diastolic heart failure. So one's where your heart doesn't relax quite properly, so it doesn't have the time to quite fill up so that it can pump out the amount of blood it needs to. Another part is when it can't quite pump correctly to pump that blood out. Either way, your body's not getting enough blood that it needs to get. This can be caused by lots of different things. People who have coronary artery disease or heart attacks in the past, or if you have abnormal rhythms. First things first, you would seek medical attention so you can get the underlying causes treated first with medications and any medical management that would be recommended by your physician. Once you have a diagnosis of heart failure, how do you manage that? Well, things that happen with heart failure is your body's not getting the blood it needs, so your body responds to that. Your kidneys sense that it's not getting the fluid it needs because the heart's not able to pump as much. So it senses that you don't have the volume you need, so your kidneys actually try to hold on to fluid. So you might know people who have heart failure in your life that experience a lot of swelling or fluid retention, swelling in their legs. Sometimes the fluid accumulates in your lungs depending on what part of your heart is affected, and these can obviously cause distressing symptoms of shortness of breath, pain in the legs, and difficulty with mobility. Now sometimes these symptoms can be so severe that it might qualify as a acute heart failure exacerbation or a worsening of your heart failure, which would require immediate medical attention and addressing it. This is a place where inpatient rehab like Highlands could come in. So, if after an acute exacerbation of your heart failure, some people do tend to have more debility or weakness than they used to. Let's say before you didn't need a cane or a walker to get around and you didn't need anybody's help to go to the bathroom, but now you're needing it. So these are things that after an episode like that, where we could do a short rehab stay to help work on those functionality aspects. Also, while you're here, we would continue to manage your heart failure. Things that you want to do that you could even do at home is weigh yourself daily, which we would monitor your weight here. You can catch that fluid retention by monitoring your weight. If you notice, oh, hey, I was 5 pounds lighter yesterday, or a pound, or it keeps adding on. Also monitoring your diet, which we have nutritionists here on staff in the kitchen that does a great job at cardiac diets, which would be low salt. Salt causes you to retain fluid, so that's another thing that we would manage. Also, you would have other medications on board, again, like I said, to treat whatever the underlying conditions are, but as well as management of beta blockers or ACE inhibitors, which are medications that can be used to help treat and make your heart work as efficiently as possible so that it doesn't have to work as hard. And these are all things that we can provide here to help any patient with heart failure improve over time.